Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Each week we cover topics related to the pre-med journey to medical school and beyond, from the MCAT to completing your application and from starting medical school to choosing a specialty. Our podcast will provide essential information for anyone contemplating a career in medicine.
Hey everyone, it's Dr. Marinelli here. Thank you so much for joining me. Today I have a very special guest on with me. Her name is Dr. Erkeda DeRouen, and she is a family medicine physician. And recently she has been doing a lot of telemedicine work. And today I really wanted to bring Dr. DeRouen in and so that we could talk about telemedicine, especially in the age of coronavirus and its significance. Dr. DeRouen, thank you so much for joining me.
Thank you for having me.
Would you please start by telling our listeners a little bit about your practice and kind of how you got to telemedicine?
Oh, of course. It's kind of an interesting road. So right now, I'm currently working as a telemedicine physician for a group organization who basically sees patients through an app. I didn't honestly know much about telemedicine. I've been working currently at this practice for about almost 2 years in November. But before that, my journey was more in terms of like underserved care. And I had been previously working at a federally qualified health center through the National Health Service Corps. And I love that environment. But when it was time for me to figure out my next step in terms of after working there for a few years, I looked into a lot of different opportunities, and this new telemedicine thing kept popping up. So I actually found out about the job on a telemedicine Facebook group, and I reached out to one of the doctors, and I just really enjoyed learning more about telemedicine and the mission of serving patients wherever they are. So I decided to take the leap and join as a telemedicine doctor, and that's where I am now.
Awesome. That is great. So tell us a little bit, what is telemedicine exactly? I know the term kind of gets thrown around a lot, and it probably actually encompasses different medias, but what is it exactly?
Telemedicine is a growing field, and I think that it composes a part of telehealth where you can get different types of care. But to focus on telemedicine, it's basically accessing care from your doctor outside of an office visit in a very basic sense. So it can be delivered in many different ways. It can be through Zoom meetings, or it can be through telephone encounters. And some companies even have texting services where they text their patient. And there are many different ways to become involved in telemedicine. There are some companies that hire doctors to do only telemedicine, and that's their main job for full time. And then there are some companies who have doctors kind of like an Uber for doctors, where they're kind of on demand and they wait for an alert in their phone and they'll come on and join a patient. And then there are other things that we're seeing pop up now in the time of coronavirus, where hospital systems and other medical organizations are partnering with either telemedicine companies that are already established, or using things like Doximity and Zoom to video and connect with the patients that they have a relationship with and give them more access to care.
So tell us, speaking of coronavirus, how has COVID and the current pandemic really changed the face of telemedicine?
I think that COVID really kind of highlighted the importance of telemedicine. I know it's a growing field and relatively new over the past decade, but in the time of coronavirus, there were massive shutdowns and decrease of access to going in to see your own primary care doctor or even urgent care doctors. And even if there was access and availability of your doctors, there were a lot of patients who were afraid to go in person and run the risk of being exposed, because if you're sick, you're going to the doctor, and a lot of sick people had COVID.
Yeah.
So there's been a huge upswing in the utilization of telemedicine since then, and a lot of practices have actually had to transform their models to one, offer those services to patients, and then a lot of the companies who were already established have increased in the volume of patients who are looking into them and utilizing their services. So with the span of COVID over these past 6 months, I think that patients are realizing that telemedicine can actually be a great adjunct to in-person care.
Yeah, absolutely. And do you, from your experience and from what you know being in the, I'll say just telehealth community, did you see kind of like a lag time in people receiving care and then kind of like you just said, this all of a sudden realization that, hey, I'm not going to get care right now because of coronavirus and the pandemic, but here's an option for me. Was there kind of a lag time there before telehealth really took effect or became more popular?
I'm not exactly sure of the numbers, but from personal experience, I would say that COVID became popular in the US towards the end of February and beginning of March. And I would say around mid-March, there were lots of articles and lots of activity in terms of the telemedicine world and the increase in patient volume. So I think that the word was getting out there, and it may have been via people looking up ways and alternative ways to get services. A lot of times, certain employers will offer a telemedicine benefit to their employees, but it may have been underutilized, so maybe people were looking more into that. And then with certain regular hospital practices and primary care offices now offering that benefit, people seem to have been picking up on that. So speaking to a lot of my colleagues and friends who are in brick and mortar, it seems as though a lot of their patients were actually excited for that option because they're able to do a visit from their home or their job, and that access actually decreased some no-show rates for them and allow patients to receive care and get refills and things like that.
Mm-hmm. And I think from, you practice primary care, and I can really see from primary care, myself included, like this makes a lot of sense. I mean, especially kind of with health screening or things like that, it would be really easy in a way just to talk with your patient. You don't necessarily need to be in the same room as your patient, but I could see that there's challenges for other specialties that are maybe a little bit more physical, like dermatology or something like that. But can you tell me how some of the other specialties, at least to your knowledge, are kind of conforming to the use of telehealth?
Absolutely. I think with the advent and the uptick of telemedicine, a lot of physicians have been taking time to really think through what occurs in a patient encounter. 70%, and that's just a number that I threw out there, but 70% or so of our visits are typically basically complete before we enter a room. If you think about it, when you have a nurse or medical assistant room your patient and ask the key things that are going on, when they come and they talk to the doctor before they enter the room, you already have a differential of at least your top 2 or 3 things going on. Sometimes your slam dunk diagnosis. And when you go in the room, you take a history to kind of confirm that. Mm-hmm. So a lot of times your history is correct, and you're just adding that physical exam in order to, one, confirm it, and sometimes ease the patient. I know when I was in brick and mortar and someone came in and they had typical GERD symptoms, and they were following up and talking a lot about their reflux, and we went through all the triggers like certain diet things or smoking cigarettes and stuff like that. In my mind, mentally, I knew the medication that I wanted to do and that it was GERD, but I would sometimes tell my patients, like, let me give you your money's worth and listen to your heart and lungs. So technically, I could have done that virtually. But of course, there are some things that need to be seen in person. Sometimes if you have abdominal pain, you want to confirm certain things with the physical exam and put all of those things together. And you ask the question about how other specialties are adapting to telemedicine. And I think to answer that, they're thinking of those ways too. So for dermatology, there are a lot of things where they know what it is by looking at it. So you can utilize images from a patient. Mm-hmm. Whereas sometimes you can't virtually biopsy anything. So that's when a patient would need to go in. Or for radiology, they're really picking up in virtual care and in looking at different things. I was even talking to a friend recently who was talking about going through virtual rounds in the era of COVID as an infectious disease attending. Mm-hmm. And they actually have multidisciplinary rounds where there is a doctor there in person, of course, to examine, but they have multiple people kind of on like a medical Zoom chiming in on different diagnoses and things. So it can actually help bring in interdisciplinary teams and help think through the process together and include other aspects of the team like pharmacists and things that may have not been available originally.
Mm-hmm. Yeah, I actually, during my ICU rotation in medical school, I remember one of the attendings was experimenting with an actual robot that would roll around on its own, and he would sit at home and control it and can go into patient's room and talk to the patients through the robot and examine it. I'm sure even more technologies like that are being looked at and developed, and that was several years ago. So I can imagine the leaps and bounds they've made in regards to technology such as that.
Absolutely, especially in places where there are kind of like physician deserts, where there are rural areas and not a lot of access. There are definitely other physicians who are able to monitor ICUs or emergency rooms and help with the process.
Mm-hmm. Yeah, absolutely. What do you see, and this is kind of, we've talked about it not directly, but kind of alluded to some of it here, is what are some of the challenges of telemedicine? I mean, mostly from your side as a practitioner.
Mm-hmm. Some of the challenges of telemedicine are kind of like what you said, what I alluded to is the physical exam. So a lot of times history is gold. History is important. We can get a lot of information from a patient, but sometimes it takes listening to their heart, listening to their lungs, assessing their cardiovascular status, looking at their vital signs. And there are a lot of things that are able to help assist with that. Like there are connected devices that assess your blood pressure, that can check your pulse ox. Like that is very important right now during the times of COVID, where a lot of people are having things come up. There was a time where I was a little skeptical about maybe diagnosing an ear infection in a child without visualizing it. So originally I would send those patients in because it can be different things. But now there are otoscopes that you can order on Amazon for about $20 that hook up to your phone. Mm-hmm. And if you can direct the parent as to how to look into the ear, you can see the tympanic membrane pretty well. So I think as telemedicine grows, the external technology will grow and give us more leeway to do the appropriate exam. But there are times when you cannot do that. So that's when you would need to refer them in person to make sure that you're giving the patient due diligence in their workup.
Mm-hmm. What about, this is just me kind of thinking here, but I wonder if there's any studies or evidence in regards to patient satisfaction and kind of their challenges when it comes to telehealth. I mean, I can imagine a lot of them, especially as you were saying, in some of these rural communities, or if they're very high-risk patients that can't go into a hospital setting because of coronavirus, or there's a number of issues why it would be hard for someone to physically come in. But I think, as you're saying, where there's limitations for doctors, I feel like there could be limitations and challenges for patients, especially not getting that physical touch or physical attention rather, or being, able to just freely talk to their physician or their provider. And, and we all know using Zoom and things like that over these last few months, it's not as easy sometimes to have a normal conversation over Zoom. Things get interrupted. The Wi-Fi connection goes out. There's noise in the background. I mean, there's so many different obstacles. I wonder, do you know if there's any studies or evidence in regards to patient satisfaction when it comes to telehealth versus in-person visits?
Absolutely. I think that there are quite a bit of studies going on now, and especially in the advent and the uptick of coronavirus, where they're thinking about patient satisfaction and engagement. I know that there have been things mentioned in the New England Journal of Medicine, and there are some telemedicine journals like patient engagement and on those kinds of things. And to answer your question, I think that telemedicine in its early states attracted a certain kind of patient who had access to the technology of the smartphone or the computer, or who even knew about the actual services. Mm-hmm. But now as we expand, I think it's filtering out more where different people are utilizing it and they're like, hey, this is easy because I don't have to take my mom and my 4 kids in for grandma's visit. We can kind of discuss what's going on a certain cadence. I can get my refills mailed to me by CVS or some other pharmacy, and I can get my questions answered. Like some services are 24/7. So I think there's that balance. And then there are some patients who are like, I've been with my doctor for 20 years. I want to come in every 3 months and talk about my diabetes and my hypertension and get my weight tested and all of those things. And I think there's that balance. So I think that's why telemedicine can never replace traditional brick and mortars, but it can definitely serve as an adjunct to help them to kind of triage some important things and send those into the emergency room and the urgent care, to abate visits that don't necessarily need to go in there. Like the ED is full of patients coming in at 3 a.m. with urinary tract infections, and those don't necessarily need to be seen. But when you're discussing with certain patients, you'll see they work during the day and they can't get in with their doctor, so that's when they're free. Or they didn't think that they don't have a primary care doctor or something like that. So it can definitely be a link, but then for certain things like an annual exam or something where you need to see your doctor for, you'll have more visits open in the primary care offices and other offices if you kind of utilize telemedicine to engage with those patients who can be helped outside of the office. So right now there are 2 and 3 month wait times to get in with the primary care doctor, even when you're established. So if we partner with these telemedicine companies or offer those services, it may help create access for other things that are needed to be seen in person.
Yeah, absolutely. Super interesting, and definitely an area of medicine that's going to, like you said, I think continue to grow and its usefulness kind of just expand. And I think probably has been just instrumental right now with coronavirus. I mean, I know that there's been so many people suffering from not getting care, and I think this has just been such a relief for medical facilities to deploy out and for people to access. Any final thoughts or any ideas on where you'd like to see telemedicine go from here?
Yes, I am excited that telemedicine has kind of been placed in the spotlight over these past few months. It's shown that there are possibilities to expand care. I've been very delighted when I chat with a patient and they tell me like, oh my goodness, I haven't been able to get care in months. I really need my blood pressure refilled, but I'm here on my break when I work at Walmart, and I wasn't sure that I was going to be able to be seen by a doctor, or I couldn't afford it, or those types of things. So I think that is definitely helping create access to care where it wasn't necessarily present, as well as, like I said, kind of help with the visit abatement from unnecessary visits and increase room for more inpatient care for the doctors that are working in brick and mortar. Mm-hmm. In the future, I would love to see the expansion of more connected devices in terms of, like I was mentioning, like the blood pressure cuffs that come up or the electronic otoscopes and many other things, so that we can continue to monitor outside and expand the other things that we are able to do.
Yeah, that would just be great. Well, awesome. Thank you so much. This has been really fun to chat about and even just kind of think about all of the possibilities out there. Thanks for coming on and chatting with us.
Thank you for having me. It's been such a joy to come and interact with you and to connect with everyone here through this platform.
Thank you. Thanks everyone for listening.
Our mission is to inspire, encourage, and inform students as you journey through a rigorous and intricate process of achieving your dreams in medicine. Visit us at prospectivedoctor.com and medschoolcoach.com for more essential resources in your medical school journey and beyond.